I'm here today with Dr. Neal Barnard, who is the president of the Physicians Committee for Responsible Medicine. He's the founder of the Barnard Medical Center and author, I don't know, of like 10 million books, something like that. You don't sleep or anything, I know. You're kind of a robot up there and you're just a publishing fiend. So anyway, thank you so much for taking the time to be with me today.
It's my pleasure. Thank you.
And today we're talking about part 6 of Power Foods for the Brains. And today we're talking about medicine and health conditions that affect memory. But before we dive into that, I've got 2 questions from people that have watched our videos. And so they posted these questions and I thought, ooh, these are good ones. So the first one is, if oxidation is bad, and we talked about that previously, is it bad then to eat apples or avocados that have turned brown a little bit after you cut them open?
What an interesting question. Okay, just for anybody who is unsure what the heck we're talking about, we did mention in an earlier episode that if you have, say, a rusty frying pan or a corroded penny that's all turned black, that's oxidation. And the reason that's relevant to the brain is you have iron in your brain. You have copper in your brain. It's circulating in the bloodstream and it goes throughout your body, including the brain. And those metals can oxidize in your body. When they do that, they release free radicals. But something that has already oxidized is, to my knowledge, not going to then release further free radicals in the brain. Now, you probably aren't going to want to eat foods that have gone bad. So hopefully you're choosing ones that are fresh. But the issue here really is the oxidation process of these metals in your body itself, not before you ate something.
Perfect question. That was a great one. I was like, that really stumped me. And I went, have to ask the maestro, the master.
Okay, that's what it is.
And then another question, somebody came up and said, what is your position on senior multivitamins?
This is a great question. And it's an area where there is some risk out there, in my view. We talked earlier about iron, we talked about copper, and in the 1950s, the whole idea was the more iron, the better. So you should eat red meat, and you should eat liver, and you should take geritol, and iron was added to all multiple vitamins. And then soon thereafter, people realized that the more iron that you get, it's not better, because a high iron intake was associated with heart problems, particularly in a condition called hemochromatosis, where it really builds up. But then it's also been associated with brain problems too. So we thought, okay, iron is one of those things where you need a little, but you shouldn't have too much. So the Centrum company said, all right, let's make, for people over 50, let's make Centrum silver. Let's take the iron out. That's a sensible thing to do. That's a good idea. Here's a problem. Iron is not the only actor. Copper is the same story. Copper is something you need a little bit of, but if you get too much, it's linked to brain problems, including Alzheimer's disease. Copper is added to multiple vitamins, including those ones for older folks. So my message here to the pill manufacturers is take it out. Take it out, because you're getting copper in foods anyway. You're getting iron in foods anyway. You do not need to supplement that. And to make it simple, a multiple vitamin on balance for people is often a good thing, because they may not have very good nutrition. But if you're being thoughtful about your nutrition and you're having a good, healthy plant-based diet, and you're getting your vegetables and your fruits, you're getting a lot of vitamins. So supplement not just the whole drugstore full in one multiple vitamin, but supplement what you need, which is going to be B12, vitamin B12. And if you're not getting sun, vitamin D. And that's kind of it. Because you're getting vitamin A activity from the beta-carotene rich foods, that gives that to you. You're getting the other B vitamins from your grains and beans and so forth. So you really don't need it. So senior vitamins, yes, the risk is too much iron, too much copper.
So save your money. Eat plant-based.
Yeah, exactly.
All right. So you just saved people a bunch of money from buying monthly vitamins. And they can be quite pricey too. So, especially good quality ones. All right, so let's talk about medicine and health conditions that are going to affect our memory. I know there's a lot of people that are on medications. I don't need to tell you this, but can medications add up their effects and cause issues with memory?
If a person has any kind of issue, any kind of brain issue, whether it's a memory problem, Sometimes it could be depression. It could be getting revved up. It can be anything. The first place where I encourage people to look, and the first thing that a doctor is going to ask is, when you walk into your bathroom and you open up the medicine cabinet, what is new there? Because very often a medication change can lead to all kinds of brain problems, particularly something that has occurred suddenly, something out of the blue. And it can be all kinds of medications, and sometimes a medication that can be benign in and of itself. You add it up to other medications and you get problems. So yes, number one issue for the brain is medication.
Wow. Okay. Can drugs interact with food, and can this cause problems to the body, which could affect the memory?
They can. The classic case is grapefruit. And in fact, doctors are pretty savvy to this. They'll say, all right, I'm starting your cholesterol medication. Don't take grapefruit. And what the doctor's right. What the doctor is thinking of is that grapefruit, which is a funny fruit, it's not natural. It's, if I recall my botany correctly, it's a hybrid of an orange and a pomelo, I think, or something like that. Anyway, the grapefruit juice will inhibit the enzymes that your body would normally use to eliminate medication. So naturally, you take medications and your body eliminates it and you get kind of a steady state. But if you take the grapefruit and you can no longer eliminate the medication, it builds up in your blood.
That would be a problem.
That is a problem, because medications might be tolerable at the normal level, but they can be toxic at high levels. So doctors will say, don't have grapefruit when you're taking these medications.
Is there other foods that would have an impact besides grapefruit?
There are some medications that will inhibit medication. There are some foods that will inhibit medication absorption, but you probably know what that is when you're taking the medication. It'll say take it on an empty stomach or take it with food. If you don't know, ask. So it's usually not an issue, but there are quite a number of foods that will inhibit medication absorption. So there's nothing wrong with the food. There's nothing wrong with those medications. You just have to take them on an empty stomach.
Okay. Well, cholesterol-lowering drugs are probably the most commonly prescribed medications. Is there any issues with these drugs to your body and to your memory?
Double-edged sword. As we've spoken before, getting a low cholesterol level is a good thing. And if you accomplish it with diet, that's the best. But when people lower their cholesterol levels with a statin or other cholesterol-lowering drugs, typically that's going to protect their heart, and it will protect their brain and reduce their risk of developing Alzheimer's. That's good. However, there's a big group of exceptions to this. And actually, in Power Foods for the Brain, I tell a story of Dr. Dwayne Gravelin. Dr. Gravelin is a real person. He was not only a physician, he is not only a physician, he was a NASA astronaut in training. He was working for NASA, and he got home one day in his car. He got out of his car, and there was a woman at his front door, and he said, "Hello, who are you? How can I help you?" And she says, "Dwayne, I'm your wife."
Ooh.
And yes, she puts him in the car. They race to the emergency room, and she says, "My husband, his memory is gone. He did not recognize his own wife," which was the case. And so the doctor does a whole exam, and they're trying to think what had happened, because he was more or less functional, but had these big holes in his memory. And the only thing that had changed in his life was he'd had a high cholesterol level. He had started a statin. He'd started Lipitor. Atorvastatin is the generic name, one of the most popular drugs in history. So they thought, could that be it? Well, statins are pretty safe, but let's stop it. His memory came right back.
Wow.
100%. However, so did his high cholesterol. So after a while, they put him back on Lipitor at half the dose. And within inside a month, his memory was completely wiped out. Everything after age 13, gone. So they stopped it again, and I'm happy to tell you his memory came back again, and now the Lipitor is in the trash. And there is a letter in the inbox of the FDA saying, here is a case that you ought to know about. Well, statins are supposed to be healthy, and yet the FDA started getting hundreds of reports of the same thing, including from people who had been diagnosed with Alzheimer's disease and were in nursing homes, condemned effectively to die, who got better when they stopped the statin, and they packed their bags and they go back home. So statins are a double-edged sword. They're generally safe. They're among the safer medications we have, and they do have benefits. Although I have to say this, they are not benign entirely. They cause muscle problems, they cause liver problems, they increase the risk of developing diabetes, they cause a little bit of weight gain for some people, and in rare cases, they can be devastating for the memory. And what I have just described is now in the prescribing information of Lipitor. It says, be on the lookout for this because it's going to happen. And it's not just Lipitor, it's other statins as well. So without beating up the statins too much, I do want to say that 90% of the people who are on them, in my view, do not really need them. What I mean to say is they are taking them to counteract the effects of the cheeseburgers and chicken sandwiches and wild-caught salmon and all these other things that are contributing animal fat and cholesterol to their diets. And if they were on an optimal diet, there would never be a case for them taking these drugs.
It's so true. So true. Well, what about sleep medications? Are they going to interfere with your memory?
This is a classic case. True story. There was a young man who I know who was telling me about his situation. He woke up one morning and discovered that his whole kitchen was filled with bags of potato chips and sodas and all these things, as if somebody had a party. And he vaguely remembered it might have been him. Here's what had happened. He had started taking this isn't funny, I shouldn't be laughing. He had taken a drug called Ambien, Ambien, one of the most popular, probably the most popular sleep med. You take Ambien, it puts you to sleep. However, if you happen to be awakened by something, somebody honks their horn or something like that, and you wake up, it can make you kind of in the mood to party. By that I mean, he in this situation got his car keys, went to the store, bought all this food, came home, ate all this stuff, and fell asleep. But the other side effect,
and he didn't know it.
The other side effect is it wipes out memory for the time when you were taking the medication. And so many people have sleepwalked or sleep driven. They're really not necessarily asleep, they're awake, but their memory is shot. It's gone for that period of time. So you can carry on a conversation, and then the next morning you'll not remember it. So I personally think that although these medications have a safety profile that you can understand why people would prescribe them, but this side effect is, in my experience, very common. And in fact, in Power Foods for the Brain, I have a whole chapter on how to get a good night's sleep without drugs. There's certain kind of sleep hygiene steps that a person can make. So you asked a very simple question. I gave you a really long answer. But yeah, the sleep medications are classic because, I mean, what are they doing? They're shutting off part of the brain. And so they're going right in there, turning the dials. And if your memory is turned off too, that should not be a big surprise.
Wow. Oh my gosh. That is, I can't even imagine like going to court, like you'd go out and do something bad, during this time. You're like, no, I didn't do it.
I don't mean to suggest that it will turn you into a person with a different possibility. When you talk to people who are in that state, it's sort of like somebody who's had a couple of drinks. I mean, they're still themselves, but they're in kind of a party mode. And then unlike a couple of drinks, if you have a couple of drinks, you will remember what you did the next day. When people are on these sleepers, very often they remember nothing of it.
Wow.
Yeah, it's a little bit frightening.
Well, what about antidepressants? How about that? Will that affect your memory?
They can. Antidepressants have a lot of side effects. The old style ones that were really big in the 1980s and 1990s, like Elavil and Tofranil and whatnot, yeah, they have a lot of side effects. Frankly, even the new antidepressants do. I wouldn't put memory problems past any of them. So it just goes back to what I was saying at the beginning. If a person is having a memory effect, report that to your doctor. This is time for a medication change or medication discontinuation. The other thing, when it comes to antidepressants, people are getting more and more skeptical about them, simply because although some studies have shown that they work, and I am quite convinced there are some people for whom they may be even life-saving, there are also many people where what they're really getting is a placebo effect. And the drugs are wildly in my view, overprescribed. For people where other treatments for depression can be effective for them.
Okay. How about antihistamines?
Yeah, allergy medications, very common. And yes, they can affect it. And often the other thing is sometimes you have a medication that might have an antihistamine effect, like an antidepressant, for example. And in the fall, it's allergy season, or in the spring, it's allergy season. So you're now taking your allergy pill along with, say, the antidepressant. The antihistamine effects add up and can cause memory problems, urinary problems, digestive problems, all kinds of things. Yes.
How about anxiety medications? Do these have an impact on our memory?
There's a huge group of anxiety medications called benzodiazepine. Benzodiazepines, this is Valium and Librium and so forth. But one that is really remarkable in this group is called Versed. The person goes to the hospital. They have a colonoscopy, routine colonoscopy. And their loved one comes and picks them up at the end of the procedure. They get in the car and they say, honey, how was it? I hope it wasn't really painful. And the person says, that's funny. I don't remember anything. I remember walking in the hospital. That's the last thing I remember. The reason you don't remember is that when you were on the table, they started an IV and they put in Versed. And Versed is a good anti-anxiety medication, but it does more than that. It wipes out any memory trace. And if you ask them why did they do it, they say that if they didn't, you would never come back and have another colonoscopy. Because if you can't remember what happened, you're not going to have a bad experience. Now, I'm not opposed to colonoscopies whatsoever. They can be beneficial in certain circumstances. But I do think that they ought to be straight with you and say, and by the way, it's not just colonoscopies, it's lots of procedures. They should say, by the way, you're going to have some serious memory impairment for while you're doing this because we're going to give you this drug, and let you decide if you want them to play with your memory or not. So the more common anti-anxiety medications that are not used necessarily in the hospital, but might be used at home, like Valium and whatnot, yeah, they'll have that effect. It can be often dose related. So the higher your dose, the bigger the problems you're going to have. And once again, to me, it makes a case for generally avoiding those medications and using more healthful ways of tackling anxieties that we have. And there are good ways of dealing with it. Psychiatrists are now really getting pretty savvy about safer methods.
Okay. Well, there's people in chronic pain. Oh my gosh. I mean, and people routinely are prescribed a lot of pain medications.
Yeah.
Are these going to have issues with cognitive problems?
Yeah, they may. And let me say this, first of all. Sometimes doctors are afraid of giving pain medications to cancer, say a cancer patient. And to be a little bit counter to the prevailing wisdom on this, I think that sometimes pain medications are wildly underused. The patients in the hospital, they're in pain. The nursing staff or the doctor staff, they're afraid the person's going to become an addict, so they don't give them a narcotic. When the person may have advanced cancer or they're just coming out of surgery, give them a painkiller. There's no reason for that person to be in pain. So let me make a pitch for actually using these medications when they are needed. That said, a lot of folks, and you see this with advanced cancer where their memory is really affected by the narcotic painkiller they're getting. However, that's often in kind of the initial stages of treatment. And then as they get more habituated to it, they bounce back typically, and they're more themselves when they've accommodated to it. So I don't want to deny pain relief to a person who's in
chronic pain.
who's in chronic pain.
Yeah. Well, let's switch from drugs to food. Could your choice of bread have an impact on your brain?
Oh, you're thinking about gluten. Yeah, it could. Gluten-free eating is a little bit of a fad nowadays, where you've got gluten-free
everything.
You probably gluten-free toothpaste. I don't know, but it's a real thing. 1%, a little bit less than 1% of the population has celiac disease. Mm-hmm. Gluten is a protein that's in wheat, it's in rye, it's in barley, and if a person with celiac disease eats those foods, they're going to have serious intestinal problems. And if you do a colonoscopy on them, you can see it. The intestine is really affected. But that's less than 1%. Now, another, I'm going to say roughly 10% of people, they do feel better if they avoid gluten. By feel better, I mean they're less mentally fuzzy. And their digestive tract is, their digestion is better when they avoid gluten too. So for those people, the celiac disease people and the I'm going to call it gluten sensitive people, they do better when they avoid gluten. And when I say do better, they will describe a certain kind of a fogginess
Mm-hmm.
that comes after they have a gluten-containing grain, which again is wheat, barley, and rye. And when they switch to a rice crust pizza or rice noodles or oatmeal or something like that, they say they just feel better. And so for those people, fair enough, they can do it. Now, gluten-free living is a pain in the neck, I gotta say. It makes vegan seem easy. But if avoiding gluten makes you feel better, it's fine. For the other 90 or so percent of people, they try gluten-free and they discover it doesn't affect them one way or the other, and those people can just go right back to bread.
Okay. Well, how about depression? I mean, in a depressed state, it almost feels like your memory is like switched off.
It
Will
is.
that have a long-term effect on you?
Yes, in the depression, it can be a chronic condition or a chronic relapsing condition. And when a person is depressed, everything gets switched off. Your energy level gets switched off. Your mood, which buoys you up, gets switched off. Sex drive is the first thing to go, and memory is often very, very poor. And then typically when the depression remits, people do feel better. Their energy comes back, and their memory will typically come back as well.
Excellent. That's good news.
Yeah.
Well, how about when women go into menopause? I've heard, many women say like, "Oh my God, my brain is like it's fogged up."
Yeah.
Are these problems temporary, or is this?
They will feel permanent only because it kind of like drags on for a while. But yes, but
Yeah.
no. This too will pass. This too will pass.
Okay.
But yeah, and everybody has a different experience. For some women, menopause is really a drag, where they're feeling really hot and they're sweating and perspiring and wanting to change their clothes, and they will say, "I got this just brain fog, moodiness." Sometimes this will pass. And by the way, let me make a pitch for not using hormone replacement therapy.
Please.
Nature, the argument is like this. People will say, back in prehistoric times, life expectancy was only 40 years old. So now we're living into older age, and nature didn't have that in mind. So it takes away that's complete nonsense. The truth is that there is a short reproductive window between in humans. I'm going to say humans many thousands of years ago, roughly between about age 18 or 20 and roughly 40 or 45, somewhere in there. That's the reproductive window. And before that, you're not fertile, and after that, you're not fertile. And there is a transition at both ends of it. And it is entirely normal for people to live to be in their mid-80s or beyond. And the only reason that life expectancy was short before is that people get infections or they get killed by an animal or an accident or something like that. But our bodies are designed to live through menopause and beyond. However, foods affect hormones in many ways, and so that hormonal symptoms can be exacerbated by food choices. And so if people are chronically eating meat and dairy and so forth, their estrogen function in particular gets really crazy. And then when they reach menopause, their symptoms are exaggerated. And sometimes people who are on healthy diets can get symptoms too. But regardless, this will pass.
Good to know.
Mm.
I think we all know the answer to this, but what are your
Okay.
thoughts on alcohol or drug abuse on memory?
You mean are they good for you? No, I have to say, I mean, the problems are legendary, obviously, and memory issues are probably the least of the issues. But yes, and for anybody where you're trying to figure out, why is Dad having trouble remembering anything? Old age can be a time when an addiction starts, and we don't think of it that way, but it can be. What I mean is, a person can be up in years, and that's when alcohol becomes suddenly more attractive. Same with other addictions. So be on the lookout for it.
Okay. Well, our thyroid drives our metabolism, and of late we've seen so many issues with thyroid. How is this going to impact us?
I see what you're saying, and I'm not 100% sure why it is. We're seeing both hypothyroidism and some hypothyroidism. That's where the thyroid is making less thyroid hormone. People feel fatigued, they feel weak, they got no energy. We're seeing a lot of it. I don't know why. Some people have suggested that it's diet related. It could well be. Does it affect memory? Yeah. A lot of people feel very foggy. And then when they get properly treated, they bounce right back. With hyperthyroidism, that's where the thyroid is making too much. We have seen, perhaps more predictably, diet changes helping there as well. In any of these cases, I encourage people to work with a good endocrinologist, track their, make sure they got a really good diagnosis. Do follow a healthy diet. Some people are going to need treatment though, regardless.
Okay. Well, I'm a chemistry teacher, and this is one of the things that truly bothers me a lot, because they've been fluoridating our water system. Some states do, some states don't. I live in a state that does. So just basic high school chemistry. You've got the halogen groups. Okay, fluorine is the most electronegative element. And
Right.
Just in a single chemical displacement reaction, fluoride will displace anything that's below it. So that's fluorine, chlorine, bromine, iodine, astatine. Iodine, one of the major things that we need to run our thyroid.
Right.
Here we are drinking this water that contains fluoride, but it's going to displace iodine in a chemical reaction. Would that have an impact on it?
I don't know. I don't think anyone knows, but I think it's a really, really smart question. And I have to say that I think it's one of many good reasons to not drink tap water. Much as I hate to say it, I wish that what came out of the tap was pristine. It is not. We talked earlier about in some places there is aluminum in the drinking water because it's added at the water filtration plant, and they add it to get rid of solids. And then if they don't remove the aluminum, it will come out of your tap. There can be other things in the water too. So I encourage people to actually drink either very well filtered water. Mm-hmm. Talking about like a reverse osmosis filter, something like that, or have spring water just delivered to your house in those big tanks, or you can pick it up at the store. That's clean. That doesn't have fluoride in it. I think you could probably shower in fluoridated water, I hope. Although who knows if it vaporizes and you inhale it that way. You can wash your clothes in it, probably well. You can even wash your hands and dishes in it. So I wouldn't drink it.
Okay. Well, I wish we had more information about it, because it definitely,
yeah.
When you just think back to basic high school chemistry, yeah.
No, I think it's a very smart question, and I think it's a question that's been controversial. And some people say, "Oh, don't be a conspiracy theorist." But what you said is exactly right. You're adding something to every single person's drinking water.
Right. They say not to. Like when you go to the dentist and you have like a fluoride treatment, they say don't swallow this because it's
right.
Because it's poisonous. Yet we're putting it into water that we're drinking, which upsets me. But,
I'm with you.
Yeah. Okay. Well, what about infections to the body? Can these also cause memory issues?
Yeah, they can. It's really sort of proportional to the seriousness of the infection. So, and chronicity. So on the really bad end of the spectrum, of encephalitis syndromes or Lyme disease or HIV, where the brain really can be assaulted really quite seriously. One of the first patients I had when I was in practice was a young woman who had HIV, and it ended up causing all kinds of brain problems, and surprisingly enough, brain complications were the first tip-off that she had HIV. So, and lesser infections can cause problems too. So yeah, when a person has acute brain issues, infective organisms are going to be one of the things that's kind of high on the doctor's list of things to check for.
Okay. In the past, I have typically experienced like horrific migraines, and I know my brain feels like it's in a hangover state. Oh my God. Could this be causing issues on the brain too?
Migraines are a really fascinating issue. By the way, for people who don't know what a migraine is not a bad headache. It is, you can have a stress headache where for a couple of hours after a tough day, that's a bad headache. A migraine is a sledgehammer hitting you in the head, and it's going bang, 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 often on one side. It's pulsatile, and it can have an aura of visual changes. Not necessarily, but it can have it. It doesn't always. And it lasts a long time. It'll last overnight into the next day. It's way beyond just a tension headache. And the good news in this is that for some people, they find that foods are a trigger for it. Surprisingly enough, the most common is dairy. And by the way, it's not just aged cheeses. If you go online, you look up foods that trigger migraines. Let's say aged cheeses and sausage because they have compounds in them that affect the brain. Fair enough. But it can be any dairy, even non-fat yogurt. The protein in it for some sensitive people triggers the migraines. And so when you avoid that food and then you bring it back in, you do it enough times and you start to see which is triggering your migraine. The problem is that there are lots of triggers, lots of potential triggers for migraine. And I just encourage people to, if they have migraines, at least once in your life, get all the triggers out of your diet, reintroduce them one at a time, and see which one triggers the pain. We had a law student here not too long ago, and she would have these migraines. And I got to tell you, when you're a law student and you got a migraine hits you on Wednesday and you got an exam on Friday, you are toast. You can't function, you can't read, you can't think. All you do is you lie in the dark because if you fall asleep, sometimes you wake up without the migraine. She came in here, we did an elimination diet, very simple. Dairy was her thing. And she avoided dairy. She's completely migraine free, doesn't have them anymore. So we see that quite commonly. And so anyway, it's a good thing to do. And I've written in a prior book, my book, The Cheese Trap, in fact, come to think of it, which you and I talked about, it does describe the elimination diet and how to do it.
Yeah. Mine was, I think, hormonal because I started in my mid-40s. I'd never had a migraine before. And then and my doctor sent me to a specialist, a neurologist, and he had me dead. I'm not kidding. He's like, yeah, until I went to the OBGYN and she said, "Have there any changes?" And I said, "Oh, I started getting migraines." And she's like, "Oh, yeah, that's normal." And I'm like, "What?" The neurologist had me dead and you're telling me it's normal. Okay, you guys need to talk. So anyway.
Yeah. Well, what you're raising is an important point. I've been making a big pitch for food, but it's not always food. Food is one thing you can really control. But if it's related to a life change, for example, then the answer is you let the calendar pages turn, it goes away.
Yeah. I mean, since I've been post-menopause, none.
Yeah, exactly.
So yeah, we're good. We're good. I wish the neurologist had told me that because I seriously, for about 6 months, I really thought I was dying. He told me it was going to be some kind of brain disorder.
Yeah, we haven't found the tumor yet, but I'm sure. Yeah, exactly.
Yeah, exactly. And I'm like, should I pick up my coffin? What? I mean, and I had teenage kids, so it really stressed me out. I mean, big time. So that was, but I'm good. I haven't had one. Thank you, because they're awful. They are.
Yeah, they sure are.
How about if somebody's undergoing cancer treatments? Chemotherapy is incredibly toxic, and this is why the doctors use it because they're trying to kill the cancer cells. So, could this be causing some issues too?
It causes lots of issues. One of which is what is commonly referred to as chemo brain, and women who have had breast cancer and they go through chemotherapy, they very often report this, where they just say, "This is my new normal." And the bad news is that for many of them, it does not improve.
Wow.
It has caused a certain toxicity to the brain that for many of them is more or less permanent.
So is it affecting short-term or long-term or both?
All of the above.
Wow.
And you'll see it in a couple of ways where if you think about what memory is you took in a fact and you encoded it in your memory so you learned it and then you retrieved it later. So there are two different parts of this. One is getting it into the brain and the other is finding it once it's there. And I believe that it can affect both of those. So it's not necessarily just that you can't find it in your brain. You may never have really registered it in the first place.
Wow.
Yeah. So anyway, I have to say I'm not a big chemotherapy cheerleader. It certainly has its role, particularly for certain leukemias and lymphomas and that kind of thing. But no one should walk into this without tremendously careful deliberation with their caregiver.
Yeah. That's going to have a huge impact on your life. Huge.
Yeah, it sure would.
Well, what about diabetes? I mean, are they at heightened risk for something like Alzheimer's and if so, can you explain?
Yeah, about double the risk. There was a good study in Japan where researchers brought in a large group of people And they didn't ask him if you had diabetes. They tested everyone because some of the people didn't know they had diabetes. Then they followed them over years, and those who did have diabetes based on blood tests were at double the risk of developing Alzheimer's. Why? I don't know. It's been reported many, many times that people with diabetes are at higher risk. Could it be that chronically high blood sugar is toxic to the brain? Maybe. Could it be that insulin can be harmful? Or could it be that it's helpful in some way? I think we really don't know. But people are actively studying this, and some people even refer to Alzheimer's disease as almost a variant of diabetes. I think the bottom line is this, that we want to do everything we can to prevent diabetes, and we also want to make sure that our diabetes is really well managed.
Mm-hmm.
And so that means, frankly, the same kind of diet we're talking about for other things, getting away from the animal products and the grease and the junk food. And these steps, we believe, will help prevent Alzheimer's, but will also get the diabetes under better control.
So we've just discussed some of the most common problems affecting the brain. What are some other potential problems?
Other things that can affect the brain?
Yeah.
Well, all kinds of things will affect the brain. I suppose the number one thing to think about is trauma. It's been in the news so much lately about football players.
Yeah.
That they are on the line and they're doing this, play after play after play. But it's not just pro players who are doing this, it's kids in sports who are doing this. And you think about the 14-year-old kid who wants to make the team, and so they're really traumatizing themselves. And it's not just necessarily football. You can have kids who are playing all kinds of sports. And I don't want kids to sit home and just do video games. I do think it's good for kids to be physically active. But you want to be safe. And you want to make sure that you avoid unnecessary trauma. And obviously there are traumas that can happen through car accidents and lots of other things. And then there are other conditions that can occur. A person might have to have surgery for something that comes out of the blue. Brain tumors can arise. People are exposed to radiation for a variety of reasons that can affect the brain. And there are a wide variety of brain conditions that can occur, from MS to Parkinson's disease to Huntington's disease. Many, many things can go wrong. The brain is a remarkable organ for all it can do in its amazingly compact size, but it's also fragile and subject to being abused.
Well, thank you. This has been an absolutely amazing series, and I think it's helped so many other people, judging from all the comments. So thank you so much for doing this. And
well, thank you for all that you do to get the word out to people. It's been fun, and I hope that people have found it worthwhile as well.